I want to now welcome David Zammit, currently in a global program leadership role. I'm going to let him go ahead and introduce himself because he can do it better than I can. But I'm so excited to have him here. He's been a super mentor to me during my industry career. So I'm so grateful that he said yes when I asked him to if I could interview him today. So David, I'm going to turn it over to you to introduce yourself to everyone.
Thanks, Joanna. Thanks for the opportunity to come and have a chat. So my name's Dave Zammit. I've been in the industry now for over 18 years, with maybe 13 years as a global program lead, or the equivalent role as it's called in different companies. I started out doing a PhD in immunology, which is my specialty. Came to the US to do a postdoc and never left. And after doing a postdoc, that's when I decided I wanted to get into industry. Life in academia really wasn't for me. And I've worked at various companies. I started out as a bench scientist for a small biotech, and then I moved to a CRO who was doing a lot of toxicology work. I was in charge of a lab there. And then I moved on to two different Japanese companies, and then another small biotech was employee number 6, so super small. And then finally, I'm now at Bristol Myers Squibb. Although the opinions I share and everything that we discussed today are just my own thoughts and opinions and are not any way representative of BMS in any way.
Thanks, David. Yeah, you've had quite the interesting journey, so I'm really excited to dive in with you. But before we get into some of the nitty-gritty details, I think one of the first things I always start off with for people who maybe are not as familiar is what actually is a program leader. In your definition, I know it can be called a couple of different things at different companies. I know for your title currently, it's a global program leader. So can you give us a little bit of an overview of what that role actually is?
Sure. A global program lead, they're responsible for an asset or multiple assets. And part of the role is to shepherd that asset through the development process. In some cases, it's just through the early stages. Others, you take it all the way through to commercialization. We're responsible for overseeing the strategy for the asset, like how are we going to develop it? What is the best way that we should go about trying to do this? And most importantly is that you lead a team of experts. We sometimes refer them as subject matter experts or SMEs. And the idea is to try and have everyone pulling in the same direction at the same time and understanding where there are different needs for different functions, for information, for timing, and so on, and then trying to get that all coordinated. And importantly, we help convince the organization of the strategy for the asset and the way it should be developed. So I think that's probably a good high-level summary of what we do. A lot of it is problem solving. That's mostly, I'd say, what we do on a day-to-day basis. There's always challenges. Things never go smoothly or in a nice straight line.
Well, aren't we all akin to that, especially when it comes to drug development? There's always some curveball thrown our way, I guess you could say. What are some of the main skills that a person who was interested in moving into this role would need to develop in order to be successful or even be considered for a role such as this?
Yeah. Let's start with the ones to be successful, and then we can go to the ones that are considered. So the most important thing is to be able to communicate. You work with a lot of different individuals. Many are super good at their given speciality. There are often, many varying points of view on what is the best path forward. And what we deal with are a lot of unknowns. We're using our combined experience and knowledge to try and work out what's the best path, but we don't have a crystal ball, so we don't know what that path is. Yeah. So for communication, it's not only how to, for example, communicate up to leadership to try and present a succinct picture of what they need to know, but it's communicating across to the rest of your team about what it is that we're trying to achieve. and then communicating outside of your team to other stakeholders that you might have so that they know what's happening and what the strategy is and how we're taking the path to fulfill it. So that's the number one skill set that you need. You need to be able to communicate with people. You need to be able to listen. You know, communication isn't just talking. Listening is super important. You don't know everything. You're never going to know everything. I'm never going to know as much about, you know, molecular chemistry as my colleagues who are molecular chemists. So you have to learn how to listen and then try and take in their views or understand their positions where they may conflict with someone else or another function and put that together. So that's the number one, is you have to be able to communicate. In terms of actual skill sets, it's pretty varied and it depends a lot on which company you're at and what their leadership is really looking for. You know, a lot of places they want someone who is an MD or a PhD. That's not really something that has to be a prerequisite, to be perfectly honest. So they want someone who can understand the science, especially if you're in the early space. You do need to understand some of the scientific stuff. Typically, you need to have a really good grounding in clinical development or drug development, not necessarily clinical development, but drug development in particular. So you need to know the process as it goes through each of the steps, why they're there, understanding, you know, what the purpose is and what you need for those. And if you don't know, you need to know to ask. You know, again, you're not supposed to know everything, and asking because you don't know is not a terrible thing. It's actually really prized. So typically they're looking for some kind of specialty experience. And it doesn't have to just be clinical trials. It could be toxicology and regulatory experience. You know, through regulatory experience, you get a great window into all of the different aspects of drug development as it goes through. So it's a great way of learning that entire process. Some people come from a commercial background where they have a really clear understanding of, you know, what is the end result we're aiming for, and then how do we sort of work backwards and try and get there. So typically you need to understand the drug development process in some form, and that many different ways of doing it. Program management's another one. So there are lots of ways of getting that experience without necessarily being involved in clinical trials directly.
Yeah, that's actually a great point that you bring up, because I think a lot of people assume or presume that you have to have clinical trials experience or expertise to be able to move into a role such as this. But I think what I'm hearing you say is you could have that, you could get that experience from other functions of the drug development process, from a regulatory, from a commercial standpoint, as long as you can really take a step back and trust and lean on the experts in those areas to guide, make good decisions, and then for you to, as the lead, kind of synthesize that information and bring it all together into kind of a overarching strategy and plan to execute on.
Yeah, it's true. Like, you know, regulatory is just a great example of a function that doesn't necessarily get into the day-to-days of a clinical trial, but they're involved in all aspects of it. Program management is another really good example of that. And yeah, you do have to trust your experts, and you have to remember you're not the SME anymore. Whatever function you've come from, you have an SME, and you need to let them be that SME. That's probably the hardest transition that you have to make into the roles for GPL, is that you're no longer the SME. So, you know, don't try and be the SME. That's a really hard lesson.
That's actually really interesting that you said it that way. Like, don't try to be the SME, because you have somebody on your team that is responsible for being sorry, when we say SME, we mean subject matter expert.
Yep.
So it's interesting that you said it that way. Like, don't try to be that. You're the one who's got to bring everybody together on the same page. So I love that. I love that. That's great advice. Um, so I want to kind of jump in a little bit into your own personal experience, because you've kind of came to this role in a little bit of you and I've talked like ahead of time that, you know, you didn't really have a traditional path into
Yeah.
industry and into this role in particular. So, can you tell us a little more about that journey and really specifically, actually, because a lot of times we focus on like the successes in this series, which is important, but also like where you might have stumbled along the way, because that's, I think, something that people struggle with is, if I get a no for this role or for trying to move into a certain role, that's it. Like I'm done. And really it's you sometimes have to, the no's are part of the process, I feel like, and you have to kind of pick yourself back up and figure out, learn from that and like figure out what's next. So can you share a little bit about some of those points in
Sure.
your journey?
Sure. So when I was doing my postdoc at the Yukon Health Centre, I'd worked out through talking with a PI there that I really didn't want to do academia and I wanted to go to industry. And getting the industry job was actually really difficult because, I'd done a postdoc, but there was nothing else in my background. So when I got the first job was with a small company called Elucis Therapeutics. It was the only one that was actually interested in me. Most of the others, you know, unless you were a molecular biologist back then, it was kind of like a little bit harder as an immunologist. So, I was finally able to pick up a role. But for me, the hardest part was that transition from academia to industry. My postdoc was with a really high-powered lab, a guy called Leo Lee Francois, always publishes in the top journals every year consistently. Everyone in his lab publishes. He has really strong group. And then we used to get together with other groups. So things like when you had to have your lab meeting and present data, that was just brutal. You know what I mean? It was just, it was, you had to be really good with taking criticism and advice, because if you had anything up that you were presenting that was just a little bit off, you would hear about it and you'd sort of get pounded for it a little bit. Not from Leo, who was wonderful. He would do that privately. But from your colleagues and your workmates, people that you work with on the bench, it was their rigor that helped you improve, but it was also very tough. And when I moved to industry, that's how I was with lab meetings. And if people had some dodgy data, I was basically in academic mode. And a friend and mentor had pulled me aside and said, listen, you don't have to do that in the industry because we're all on the same side. He said, you just have to say it once. If you think it's really important, you could like mention it again, but you don't have to hammer them. He said, people will know that you're right. It's okay to just, say it and just let it go. And that was some great advice, but it was really difficult. That transition and learning just a whole different way of behavior is hard. Academia, we're pretty relaxed. It is very competitive. You're collaborating and competing with your colleagues all the time, and eventually you're going to be competing with them for grants if you stay in the academic realm. So it's not unusual, whereas in industry, you all want exactly the same thing, and that's the drug to be successful. And it's a very different focus on how to get there, where it's much more of a team effort within industry to push through. Quality of work is the same. The science is outstanding, but how you go about getting there is different.
Yeah. Yeah, that's a really interesting and I think probably relatable example for a lot of people, because that first transition, I remember when I transitioned also from academia to industry, it's like the compliance aspect was new for me. I was on the commercial medical affairs side first for a while.
Yeah.
So it was also like learning how to be, compliant in that way. But I think you're right, like that team mentality, like we're all on the same team here. Is an interesting transition from a lab, from the academic lab to the industry.
I had someone who hired me. She said that I was probably the latest in my academic career that she would bring someone across
Hmm.
because the transition is so difficult. I actually don't agree with that now that I've been in industry for a while, but it took a while for me to understand exactly what she meant, and now I do.
Why do you say that? Is that because of the unlearning of certain behaviors or
Oh
relearn or
yeah,
learning different behaviors?
yeah, exactly that process that I had to go through. I still cringe at some of the stuff I probably did when I first entered the industry, and and you never do that now. But it's just really hard because you have to change your mindset, and you need strong mentors or good mentors who are willing to tell you
Yeah.
what you need to change and how to change in a way that's constructive. And I was lucky enough to have that at several of the companies I worked at.
Yeah, that was actually something I was going to ask you is like we talked a little bit about luck in your career too. And
Yeah.
some of it is luck, but some of it is also people seeing what your potential could be before you see it in yourself. And can you like elaborate a little bit on that about like the luck in your career and some of the mentors that you came across that really like saw the potential in you and took a chance to like help you make that transition from PhD to the clinical to some of the other areas?
So the first job I got, I had two colleagues there that were mentors. One in particular, Nahal, he was terrific. He helped teach me the ropes in many ways of how to deal with the industry climate or the company environment at the time. Um, and I was able to establish a small network where they respected what I knew and how I worked and the work ethic I had, and Nahal actually either directly or indirectly probably got 3 or 4 jobs for me, like in my career, different stops where he's either sent someone my way, um, like a recruiter in my direction, or he's spoken to someone he knows that was looking for something. When I took the first role, I wasn't qualified for it at all. But two of the guys that I'd worked with at this small company said, listen, he's really smart, he knows immunology, and that's what their boss who was hiring was looking for. Now they brought me in as a translational scientist because they couldn't bring me in straight away as a clinical lead because I wasn't qualified. But within a month, they just said, right, this guy's now taking this program. QA wasn't happy because they knew I wasn't, you know, there. But these guys taught me what I needed to know. They really wanted me to have the immunology knowledge that they didn't have and work through it. So that is luck. But leading up and through my career, I've always had like a 5-year plan about where I might want to be if I wanted to head a biotech company myself. And, early on I had bench experience and then I got the CRO experience and then I started to develop clinical experience. You do get a lot of luck, but it's being ready to take advantage of that. It's building the skill set. So I use LinkedIn a lot for my 5-year career plan, looking at other people that had roles that I thought I would want, and then looking at their experience, what they'd been doing, their skill sets, and working out which ones I had, which ones I needed to work on, which ones perhaps I needed to get. And that's how I went from bench scientist to basically it was assay development at the CRO to translational science and clinical lead. All of those things were able to build on each other so that when the opportunity came, I at least had something behind me, some kind of experience behind me to take advantage of that. So, your network that you build is probably the most important thing you'll ever get out of your career. It's the people. The people will make or break any company you work for. But building that network is super important.
Yeah, a network is definitely something that comes up often in our talks. And I think it's something that people often forget about when they're in the thick of their day-to-day of their job and life and all of the things. So I want to come back to that, but I do want to address some of the questions that are coming in because some of them are related to what you just talked about. So
Yeah.
maybe we can stay on this topic for just a minute. It's because we have a question about, PhDs are coming from R&D focused roles. Weak areas can often be clinical or regulatory. So while being able to recruit subject matter expertise is a valuable skill once in the position, getting clinical regulatory adjacent roles can be challenging if you're competing with others who do have the experience. So, how would you recommend scientists aiming for a long-term program management lead trajectory to start to
Yeah.
obtain more clinical regulatory experience exposure with this in mind?
Yeah, it's a great question because that transition's the hardest. It was the hardest for me.
Mhm.
I was trying to build those skills and it was a real struggle. So it's very difficult. I think when you're looking at like jobs, if you want to change jobs and you're looking at the list of skills they want, if you don't have everything they want, you should still apply. You know, even if you've only got 50% or 70% of what they're asking for, you should apply. But you should look to try and position the skills you have coming out of R&D into what they might be looking for or are looking for. I saw some comment in there about project management. When you're a postdoc, everything you do is about project management. The skills that you have to get the timing of everything, often sometimes you manage a budget as well. And, there's lots of things that can be applied. One bit of advice I'd received very early on was, start talking to people who are maybe 5 years ahead of you, and where you want to be and asking for some advice. Um, if you're already working within a company in an R&D role, it can be easier to make a transition sideways. Some companies offer those opportunities. You should absolutely talk to your manager about ways to get some of those opportunities. And it doesn't necessarily have to be like in BMS, they have these tour of duties where you spend 6 months, half of your time or a quarter of your time doing something. It could be as simple as, just sitting in on some of those meetings so you can learn stuff that's going on. It shows you have an interest and you do start building up your skill set as you're listening to what's happening. But of course, you have to work that in with your regular job. So that's one of the ways of perhaps doing it is every opportunity you get where you can put yourself in a position to be able to pick up something. Team meetings, GPT meetings. I've had people attending that are interested in certain roles, and they're just in sitting listening. That's what they're there for. It's part of their learning experience, and I, encourage that. I usually limit it to a couple of people at a time, but that's a great way of doing it because it is difficult. I guess that also talks to Christine's question about cultivating your background and framework and so on. It's very much the same, looking at what skill sets people have, trying to find opportunities either in your current role or in new roles where you might be able to gain some additional experience in the direction that you want to go. Those would be the ways I would recommend to do it. But understand it's not easy and it's not quick necessarily. Usually they take people for these roles that have been in it for a long time.
Yeah, and I think that's a key point. It's not quick. And it is not easy. It does take time, it takes energy, it takes focus and grit to say, if this is the direction I want to go in, then I need to commit. I need to make a conscious commitment every week or every month to put time towards learning that new area or gaining
Yeah,
experience in that new area to be able to at least speak the language and I
yeah,
mean, the hardest part is understanding and learning the language, I think, of clinical, but also understanding if you're looking into this, like forgetting that experience is understanding the patient perspective because we design clinical trials for patients who have a disease. And so understanding what's going on, not just with the science of the disease, but what the patient would be going through when they go through a clinical trial is really important and being able to like map that back to how you design the clinical trial. So, ways to do this, if I can add some suggestions to what you said, Dave, is even if you can't get some kind of a formal project or something like that in another part of the organization that you're working in, find other ways to do it in terms of be curious, talk to people in the, like you mentioned LinkedIn, Dave, talk to people that are in those roles, do those informational interviews, and actually ask questions about not just, what advice do you have for me to get there, but like ask the questions about the studies. Like, what study are you working on? How did you design that trial? What were the things that you took into account for that trial? Learning the job, like take a job description for clinical development and formulate your questions that you could ask somebody to understand and learn more about what goes into that part of creating and designing clinical trials and clinical development in general, filing, all the filings, all of the recruitment, the enrollment. Like there's so many aspects to clinical trials. It's not just the design, it's the actual running of it. So take the time to like find those people if you have the luxury of it in your organization. Reach out to those people outside of your, silo of R&D and start talking to people. And if you don't have those people in your organization because you work for a CRO or something else, talk to people on LinkedIn that are active on LinkedIn. So just want to give like some additional tidbits of advice of like, how do you learn about that stuff?
If they're going to do that, they should be prepared though with substantive questions, not just superficial stuff.
Right.
You
Right.
know, you need to show that you've been thinking about it.
Yeah. Yeah. So I want to kind of jump to a couple of other questions, and maybe this goes with Christine's other question. Christine's talks about credentials. So is it necessary to have a PhD, MD, or MS to be able to move into one of these types of roles? And I'll layer on to that because you also went on to get your MBA. I'd love to ask,
Yeah.
I'm going to ask you that as a separate question, but like, what advice do you
Yeah.
have for people who are thinking about getting an MBA as well? Because that is always a question that comes up of like, should I get one or not if I want to move into a more business type role?
Yeah, it's a great question. So they typically ask for someone with a degree, and to get one without is a little tricky, although PharmD is also just fine. Um, Typically they want someone who has a lot of experience then and can show that yes, they don't have some letters after their name, but they have the actual experience. Um, it will be more of a challenge. Um, I saw someone put a comment that the problem they have with the career transition is that they're always going with opportunities, and people that have some of that experience are also applying, so they miss out to them. And that is the biggest hurdle. It's why the transition's hard. And that's why it's so important to be talking to people, just like trying to build that network that you have. I think if you're in a larger company where they know you and they know you well, you might be able to do the transition without the credentials. If you're going for a new role, that could be a harder sell to even, get through the screening, the first screening of the AI bot. So to do it without, you're either established in a company for a while where people know you, or you've got that connection. That's probably your best option. Now, if it's a new company, but people that work there know you can do the job, then that's using that network and that experience and their knowledge of your experience. So it will be challenging. I'd never say it's impossible though. Never.
It also depends on the person who's doing the hiring and their belief in you. I find a lot of differences between hiring managers. So you'll get advice from different people about what's possible, what's not possible, and what you need and what you shouldn't do. And I think the biggest thing is for you to distill down what's right for you. And again, if some of it is luck of the draw of like who the hiring manager is and their ability to see your potential beyond where you are today.
I'd say without a degree, I would try and get a project management role. That would be my choice, because you don't need one necessarily to be a PM, and you will be involved in so much, you can build that experience over time.
Mhm.
But don't
Yeah.
quote me. It's tough.
Mhm. And then do you have any advice about the MBA piece?
Oh yeah. So I did my MBA because I thought at the time I wanted to go into more of the finance, like BD role for acquiring assets with a farmer or something else. That's what I thought at the time. One of my mentors had said, because I already have a PhD, if I'm going to do an MBA, make certain it's somewhere that's worth it, that will add to what you have. So I did that. I didn't use my MBA for, I would say, 5 or 6 years after I actually finished it. It took time to be able to incorporate those skills into the job I had, partly through my own ignorance. I didn't know that I could apply that kind of stuff to what I was doing. Plus, as you get more into the roles, you understand some of the skill sets you need. So I used the strategy component of my MBA the most. So I had two specialties. I had strategy and corporate finance, I think, were the two majors I took, so to speak. And I could have had like a minor for finance in general. So yeah, I used the strategy skill set the most, understanding how to string everything together for the big picture. That was super helpful. And then the corporate finance bit does come in handy. I worked for a small biotech where they needed some of those skills. I did a lot of BD work in one of my roles, so it was helpful. Do you have to have one? No, absolutely not. Should you get one? Only if you think it's going to be helpful for whatever career you're aiming for at the time. If I was going to go towards that BD finance stuff, I thought it was really important. My career never actually went in that direction completely, but the skill sets weren't lost. It also helps to understand a bunch of jargon and stuff from the company that, I know a current company, they do have, for some roles at least, some kind of like education on how to understand the quarterly reports and stuff like that. Yeah, it does give you a leg up on some of that stuff. And, I did commercialization as one of the subjects. It was great fun, but it does help you understand more about what commercial are talking about when they use their jargon.
Yeah. Yeah, I would say that's probably a really important area to learn and understand, because ultimately I've heard this said many times on different panels, is that, great science is not enough. The science can be incredible and we can be so astounded by it, but if we cannot actually get it into a patient and then paid for when it's commercialized, it's not going to do anything. It's just going to be cool science. So learning and understanding that aspect of drug development is super critical. I'm going to come back to another question that was in the chat, because it kind of adds on to like your skills that you didn't lose with your MBA of, do you have some tips, the best tips that you have for building consensus as a global lead, especially when there are cultural differences?
Yeah. So I worked for several Japanese companies, and there are cultural differences. Like if we said most likely, which is a maybe for us, that actually means yes for them. Sometimes yes means no because they're too polite to say no. They may use a euphemism like it'd be very difficult, which was a no. So when you're trying to build consensus, this is where the listening part of what you're doing becomes so important, because you have to listen to it and try and understand it from their perspective. What is it that's driving them for this? Is it pressure from their management? Is there an expectation of something? Is it a difficulty of losing face? For some cultures, that is a big deal, especially if it's someone senior that had suggested or wanted to do something. So you have to understand where that person is coming from, trying to understand some of the cultural norms. I know the companies I worked at, you actually got cultural training, which was super helpful. At the second Japanese company, I got a pass after one session because I'd already worked for a Japanese company. They knew I understood where those challenges were. So you really have to try and understand, what is it that's driving them? And what is it? Is it loss of face? Is it just issues with power dynamics? Sometimes there can be differences with male-female power dynamics that are difficult to navigate. So listening, trying to understand where they're coming from, trying to understand where the friction points are with other areas. What are the concerns? And then at the end of the day, you're going to have to make your best judgment. So consensus is not having everyone agree. There are times we've made decisions on teams where not everyone agreed and some people really didn't agree. But as long as you make them feel like they have been heard and their opinions been taken into account, even if we move forward in a different direction, you can explain why you have to go in that direction. You have, most people supporting it, even if they don't love it, they acknowledge, all right, this is the direction most of the team thinks we've got to go. So it's hard, but the best way to get consensus is to listen. The other good way is to understand consensus doesn't mean everyone agreeing with the same point of view. It's not, that's the hardest part to learn. It's not. And quite often it won't necessarily be unanimous. If it is unanimous, it's usually pretty easy. Like you don't have an issue. So, but there, listen, and try and understand what their driver is.
Yeah. I've heard you say that multiple times today is listen more than talk. I mean,
Mm.
yes, there's a talking component when it comes to, leading a team, building consensus, getting everybody around a common goal. And so I've heard you say listen at least a dozen times in this conversation. And one of the things I want to kind of mention is listening builds trust because then you can actually understanding and empathizing or sympathizing or whatever the word is and just hearing the people out. They know that you heard their point of view, you took it into consideration, and this is the conclusion that we've all come to. And so one of the tools I actually use is actually one that focuses on how do we naturally build trust. And part of it is exactly what you said from the cultural standpoint is understanding where the people are coming from, and a lot of that is listening. And so this tool, this PQI tool, it's called Partnering Quotient Index, actually helps to understand the different ways that people build trust naturally and being able to adjust yourself to those. Because I feel like when you're a leader like this and you have all these different cross-functional people working on your team, you have to be able to adjust your leadership to the person that you're in front of. And that can be the people on your team, that could be the people that you're presenting to when it's senior leadership. So being able to kind of adjust to your audience is really important as well.
Yeah. The audiences have different needs, so you do have to adjust. Most
Yeah.
important thing is be genuine. If you're not, if you're fake or
Mhm.
you're not really presenting your genuine self, people sniff that out a mile away, and you won't gain the trust that you need to gain.
Yeah. Yeah. Absolutely. Um, so I do have one more question for you. But before we get to that, I just want to share with the group. Like I said, this series was really focused on helping people get ideas on how to potentially shift or transition their career. And so I've interviewed a number of different people, and I'm hopefully going to be posting those on YouTube soon, some of the recordings that I have. But in the meantime, if this is something that you are really seriously considering, a career shift for yourself, and you've been working towards it and you've been kind of on this journey, or you've been going through it in your brain and you're saying to yourself, okay, I'm ready for what's next. I want you to kind of take this as a sign that, you showing up today is the first step of gaining knowledge, gaining information, getting advice on what you could do next for yourself to set yourself up for success in transitioning your career. And what I want to let everybody know is I am going to be opening up my career transition program in the fall. It's going to be starting in September. It's called the Career Launchpad. I ran it in January and it was super successful for a couple of the individuals that joined. One of them was able to secure a role to do a stretch assignment in a commercial part of her organization. Somebody else secured a project management role and someone else is working towards a project management role. So if this is something that you're seriously considering for yourself, I highly encourage you to join the waitlist. I'm going to drop the link in the chat. You will be the first to get all the details once I have them all together for you to be able to register. It's a program that I'll be running in the fall that really helps you get ready and position yourself for that career transition. So I'm going to end with the last question, which I sometimes forget to ask, but I want to make sure I do. For somebody like you, Dave, who's more established in your career, What advice do you have for people who are more established in their career and how they can actually support someone, mentor someone, sponsor someone who comes to them for career advice? Because a lot of people here, I think, are looking for that. And so, for somebody like you who already is established, what would you say to your peers?
Yeah, I actually saw a question about, do you ask for a mentor or does it just happen naturally or how that happens? Some people, you know, they initiate the conversation and say, listen, I'm really interested in this. And you talk to them, and if they express an interest in wanting to meet on a more regular basis, I usually say, yes, I benefited from that my entire career. Even now established, I still benefit from having these people that take that interest in me. I personally feel like I have an obligation to try and pay that forward and do the same for others. I'm not going to invest time in someone that I don't think is serious about what it is that they want to do, or maybe have unrealistic expectations about what it is they could do or should do. And that's where being your genuine self, having good questions to ask, and not being afraid to talk about what you don't know and what you really want to achieve is, I think, really important. So for people that are established in their career, just remember what it was like when you started, especially for people on this call that maybe want to transition. Remember how hard it was, and pay it forward, and be generous with your advice and your time. And if time's limited, you may need to be a little selective, but you should always, I think, be generous with that time, and talk to someone who has a real interest in advancing their career, or just want to know more about, how things go in the industry itself. So yeah, be generous. That's my advice to peers.
I love that. Be generous. Love it. So I want to thank you so, so much, Dave. This was such a fun
Cool.
thing for me to do with you. Thank you for coming and being a guest here today and sharing your wisdom, your journey, your advice, and and being real with us about, what it is. It does take a lot of resilience, grit, time, effort. That's the hard work. The ruminating about it is hard too mentally, but like
Yeah,
when you really decide to commit, it does take work and it does take time. It doesn't happen overnight. So I want to thank you for that and for
sure,
your message about being generous, which I think is an awesome
sure.
one.
No, it's been a lot of fun. Thank you for the invite. I know someone had a comment about,
Oh,
how
and
hard it's been. I struggled to get into industry when I was putting in applications. I put in tons of applications before I finally even got to apply, I think. So it's hard and it gets really discouraging. Um, so, you know, be deliberate in what you do, and be genuine, and just keep at it.
well, thank you for being vulnerable and sharing that with us. One thing I keep telling people to keep in mind also right now is that it is not you, it is this job market. It's probably one of the most saturated at the moment, and it is extremely difficult. So I hear you, I see you. I know that's not always helpful, but just keep reminding yourself that it is not you. Because I see the confidence waning from people from, putting the effort, putting the time in, putting the grit in, and not being successful. And resilience is going to be your best friend. And this is the skill, honestly, that is, if you learning it through this, going through this job market, this is the skill that's going to take you places in your career when you get into those roles. Because there are going to be a lot of hard situations that you face where that you're going to get a no, and you're going to have to be able to pick yourself back up and show up again 10 times stronger. So I feel you, and just keep that in mind. All right. Take care and have a wonderful weekend.
Thanks, Joanna.
Bye.